Did you guys see also that there's some competency checklists for you guys to print off for Friday?
Yeah, I did see that.
Make
Yeah.
sure you bring those with you.
Okay. Yeah, I know. I was hoping we were going to be at the school today because there's a couple of things I actually need to print out, and I was like,
I had a
but
feeling.
it's okay.
I had a feeling, unfortunately.
Okay, phlebotomy quiz.
It's the number, what is it, 7 through 9? Yeah. Find that one.
You can't open this assessment in the app. Oh my Lord.
You want to try it again on your computer?
I'm going to try the Zoom call on my phone real fast, and then I'll hang on.
Okay.
Why is this doing this to me today? Okay, learning.
The same problem this morning. I could not get on the Zoom on my computer or anything. I was very aggravated. Miss McKay, what time is our class over? I never remember.
2:50.
2:50, yeah.
Okay, that gives me time to go get my children.
Yeah, we'll get done as I'll just keep moving through this once we get going. And whenever we're done today.
Gotcha.
Because I actually have to get to Vienna and be there by 3:30 myself, so.
Yeah.
Okay.
Is that where your gym is?
Mm-hmm. Is it working?
No, it just keeps doing this. Is it doing? It's like trying to focus here. Hang on. Yeah, like I click on the Zoom and it just keeps going around and around and around. It's hard to see because it's not like.
Yeah.
Mine did that too.
So, do you want me to just like maybe if I do it like on my web browser on my phone, it'll let me do it.
All right.
Okay. Like I want you to be able to see what I'm doing. Like I don't know. Yeah, I'm just gonna go to like the, online part of it, not my
That's what
app.
I ended up doing today. Was I got off my app and I went to the web browser, and then I could bring up Zoom.
Okay, cool. I'm sorry. This is
no problem, guys.
Good Lord. WVUP Blackboard. Okay. I wonder where Haley is.
She's off today. She's at a funeral.
Oh.
That's why she took the test this weekend. Yeah.
Oh, that's bad. Okay, so of course.
I can't believe it about that woman that came and talked to us.
I saw that. That is so sad.
Yeah, Linda, because I have her on Facebook. I saw something and I had to zoom out because I'm like, because it kind of was a really actually good picture of her. And I'm like, oh, I couldn't remember her name. So then I scrolled down. There was somebody else who had put something up there. She wasn't real healthy. Remember, she was even talking about that. But yeah, she's not. I don't know what happened to her, but that's terrible.
Yeah, I hate that. Did you see that TikTok I sent you? Oh my goodness.
That was fun. That was funny.
There's another one too I have to send you. I can't remember. I think it's just a meme. I'll have to send it to you. It was funny.
Yeah, it's crazy. Crazy. It working?
I've got it to where I'm like trying to scroll through all of these.
All right, you do that. I'm going to go ahead and let Alexis start. Alexis, type in all lowercase VENIP.
Wasn't that good?
I'm sorry. That's good. I'm going to have to send that one out. That's hilarious.
I thought it was good.
Mhm. My husband would appreciate that one. Does it work?
Yep.
Okay,
Get
I'm
it?
gonna stop.
Sorry, that
I'm
was
gonna
my dog
I'm
in
gonna
the
stop my
bathroom.
video on here, and I'm gonna switch to Zoom on my phone. Okay.
Got it.
Okay.
I think you have the same question on here
Oh,
twice.
look,
I
I'm like
do.
on here twice. This is weird. Leave.
Chelsea, you're everywhere. Yes, Alexis, there is a question that's on there twice.
Okay. All right. Now, good Lord. Windows just messing me up, man. All right, let me get to my blackboard now. What, babe? Go. Here, do you want to do it? Well, just tell him you have to go. Okay. I'm sure he'll be done in a minute, baby. I'm in class. Right? Just go. Because I'm in class. A minute.
She's like, excuse me?
I'm like, Graylin, please go. Graylin, go tell Dee. Go tell Dee. Go.
Too cute.
In a minute. Graylin.
Uh-oh. She's getting a look, I bet.
Yeah, I do that a lot. Mine aren't as discreet as they used to be. I can't because they're getting older. So I'm just like, I'm going to kill you.
Mhm.
Sorry, guys.
It is
She's
no
not up.
problem.
Okay. I am here and I need the, oh, I'm ready for the password.
Okay, so VENIP.
Is it capital?
Nope.
VENIP. Okay, BENIP.
No. B
V.
as in victory.
VENIP. Okay, got it.
Got it?
Yep.
Okay.
I'll probably get my book out of the way. That would be helpful. Okay. Sorry, I'm getting a phone call. Hold the decline.
I'm finished.
Okay.
Sorry, I was getting a phone call there. I had to end it.
Mommy, lipstick spread all over my face.
Oh my god. Graylin, I'll deal with you in a minute. Go. I'm in the middle of taking a quiz. Please go. I'm finished.
Huh?
I'm finished.
Okay. All right, let's get going. Let's try that one. All right, so let me get it all set up here. How did you guys do? How do you think you did on that quiz?
Yeah, okay, but I could have done better.
Me too.
Yesterday, when the girls took it, they were like, "Ah."
Yeah.
And I think it was the order of the draw, right? That got
Yeah.
you? Yeah. Okay. All right. So today we're going to talk about two different things. Chapter 10 kind of concentrates on capillary and dermal punctures. So we will at one point go to our NHA account, but I think it's actually our old account. So once we get there, we'll see what's going on there. But let's talk about capillary. You guys know a lot about this already because you've already drawn some of these. So let's kind of just review here. All right. So can you see my PowerPoint? Make sure you can see that. Showing up? Okay, all right. So of course, venipuncture is the most common way to get blood samples, but there's going to be times when we cannot do that, either because we are taking too much blood out of the person and it could make them anemic or something else, or maybe it's a small infant or something like that, or we're doing point of care testing. So we'll talk
Is
about
this chapter 10 PowerPoint?
chapter 10. So when we need to do something different than venipuncture, the capillary collection is going to be the preferred method. It's going to be the preferred method for newborns and infants when we're doing like bilirubins or the screening that they have to go through. And it's also going to be the preferred method for point of care testing. Point of care testing means like we're either doing it right at the bedside or we're set up like in the mall doing blood screenings for certain things. Okay, something like that. Capillary collection is used for blood glucose testing, which you guys have done the glucometer, so we will talk a little bit about the finger sticks. Children under 2, we use it for geriatric population, those who might be obese, and those again at a risk with deep venous puncture. So if they are at risk and they have bleeding tendencies, we might do a capillary one instead. Okay. Also, we're going to be doing it on those only needing a dermal puncture. Okay, so what if the person has to have constant, frequent blood tests, like that glucometer check? You know, we wouldn't want to be drawing every 2 seconds and filling up big tubes of blood just to check their blood sugars. Okay. Also, people who have burns and scars that we cannot get to those veins, we're going to use this capillary. Adults undergoing, again, that frequent blood glucose monitoring, this is going to be the perfect way to do this using the capillary collection system because we only need a teeny bit of amount of blood, you guys know that, to be able to get the reading. And like I said, it also may be used for those who may be too heavy, that we can't see the veins. Also people who have very tiny veins and you can't hardly, they're just too fragile to start puncturing with a big needle. Okay.
That's Alexis.
Yes, that is Alexis. That's what I was thinking. Yeah. Yeah.
Yeah, my veins are just not visible.
Yes, they're very tiny. Okay. Venipuncture may be contraindicated for those who have scars or burns. Okay. And also those who might be at risk for that deep thrombosis or blood clotting. So we don't want to be poking around on something like that. Sometimes people who keep getting blood taken over and over and over might develop an anemia. So that's, again, we want to start doing more capillary collections instead of big needles and tubes. Somebody who might have a tendency to hemorrhage, capillary is more safe. What else? And again, so remember, make sure you know this word. The laterogenic anemia is caused by excessive blood draws. So somebody might be in the hospital for 30 days and we're in there 10 times a day drawing blood, they can get anemic. So we need to watch for that. Again, it is the preferred method to collect on newborns and infants under 2. Because young children have smaller veins, and remember, they have less blood volume. So they're going to get anemic or get into dangerous situations if we draw large amounts of blood out of them because they don't have as much blood as we do. Okay. Some tests cannot be performed on capillary collection, things like blood cultures and some routine coagulation tests. So it's not great for everything, but we can use it for many things. Okay. Here, let's see. What's happening here? Let me just check something real quick. Okay, there it is. Let me go back one. All right. Dangers for newborns. So when we do draw blood, we're reducing the blood volume in a venipuncture with a newborn. This can lead to anemia or even cardiac arrest or death. So we have to be very careful about how much blood we are taking out of an infant or a small child. It's not appropriate for somebody who's severely dehydrated. Their tests may not be accurate. So at that point, we might have to do a venipuncture for somebody who's severely dehydrated. But then again, you run into, if somebody's really dehydrated, their veins are very small. Okay, so good. What's this say? These are really out of order. I don't know why. This one says, I can't read it because of my thing up here. Good candidates for dermal collection include patients who,
D.
what do you guys think?
D.
All right. D is right. Good. All right. And this one says capillary collection may be appropriate in geriatric patients because,
B.
was that B
B.
or D?
B.
B as in
B as in
boy.
boy, right. Their veins tend to be small and fragile, correct. All right. This is kind of silly, but capillary punction, they collect blood from capillaries. The arterial proportion in the sample is increased when collection site is warmed. So if you warm that site, we're going to expect that that arterial portion of the sample is going to be increased. Okay, so we're going to have more arterial blood in that. If the patient needs repeated things like potassiums, calciums, total proteins, hemoglobins, or glucose, you must use the same collection technique each time. So you can't do a capillary one time and a venipuncture the next time. So we need to be consistent with that. Remember that capillaries are bridges between the arteries and the veins. So when I'm talking up here with this one, when I said the arterial proportion is increased if you warm it, when we are collecting capillary blood, we're actually getting a mixture of arterial blood and venous blood, okay? So you're gonna have a mixture of those and small amounts of also of tissue fluid from the puncture site, maybe in that sample, okay? Especially that first drop. So remember when we do the finger puncture, we wipe away that very first drop and then go, that's one of the reasons why, okay? All right, so skin puncture devices, they automatically deliver that puncture, right, with a swift puncture that's predetermined in your little puncture, whatever the mechanism is that we're using, okay? We want to make sure that that's the kind of system we're using because the bone is very close to the area that we're puncturing and we don't want to go too deep, right? Again, they're regulated by OSHA. Some devices are contact activated, whereas others require you to actually push the blade into them. And I think we've actually experienced both types. We'll practice that a little bit more this Friday. All right, here's just an example of a puncture device. So then there's something called micro collection tubes. They're also called bullets. And they're made of plastic and they're available with a variety of anticoagulants and additives, just like your big tubes, okay? And they can hold up to 750 ULs of blood. They're color-coded by the additive to match the coding system of your evacuated tubes. That makes it nice. Capillary tubes are available in plastic and come in a range of sizes. Again, they're in plain or blue band or heparin coated with red, yellow, or green band. We'll kind of look at a picture of that here in a minute. Then there's a micro hematocrit tube, and they're small plastic tubes with a volume of 75 ULs, and they're used not very much. All right, here's an example of what I'm talking about. See how they're color coded? They supposedly match what you're using for your evacuated tubes. Okay. There's warming devices that we can use to increase the circulation, especially when we get into learning about the heel sticks for the infants. we use a warming device, okay? Some places you just use warm towels or washcloths that are soaked in water, and then you apply it to the area. There's also devices that units might have that are warming packs that you can use. The temperature should not exceed 42 degrees Celsius, and it's applied for about 3 to 5 minutes. So remember, 3 to 5 minutes, okay? Same thing with capillary collection. You use alcohol pads to prepare the site. You have gauze ready and et cetera to help stop the bleeding. So it's kind of the same process. Use Sharp's disposal container for your lancet. Glass slides are used to prepare blood smears, which we'll get into more next week about blood smears and things like that. When we do use blood smears, we can look under a microscope to look at the cells. All right, here's some supplies that you would need to do your puncture, your gloves and your alcohol pads and your gauze, and you've got some kind of puncture device here, and your tape and et cetera. And there's your containers to put it in. All right, so on this one, an infant heel warming device should be applied for how long?
D, 3 to 5 minutes.
3 to 5 minutes. Yeah. All right, so how do we pick the site? It should be on warm, healthy skin, away from any kind of scars, bruises, or rashes, okay? We don't want, if somebody has got extremely skinny fingers and there's hardly any meat to it, we have to be very careful. We don't want to puncture the bone because we can get into a condition called osteochondritis, which is a painful inflammation of that bone or the cartilage, or osteomyelitis, which is very serious. It's a bone infection. So we have to be careful not to go too deep or too close to that bone. Again, you want to avoid any skin that's damaged or compromised. Things to avoid are like calluses. So if you've got some farm guy who works the farm and he's got calluses, real deep calluses on his fingers, you need to try to find a finger, maybe that's not as calloused or scarred or burned or whatever. We don't want to be puncturing any kind of infected wounds or areas that are bruised. We don't want to use the same site all the time. You'll find people who do their own blood at home. A lot of times they use the same place over and over and over. We can take advantage of when we're at the hospital doing it, saying, hey, let's use another finger because that finger looks pretty sore. So we want to make sure we try to use a different area, okay? Also, if somebody has an arm that maybe she's had a mastectomy and had her lymph nodes removed, and that arm swells a lot, if we can use the other arm or the other hand, then we would use the other hand.
Just wanted to show you what my kid decided to get herself into while I was taking a test.
And what is that?
There, it looks like a bunch of lipstick all over her, and then she added some nice, pretty black eyeshadow on top of it.
She looks gorgeous, like a
Nice.
fashion model. Very pretty. Looks like a princess.
I'm like,
Yes.
you're in dance class in a little bit. Can you please not do
That's funny.
Anyway, sorry to interrupt.
That's all right. That's funny. All right. So the width and the depth of your puncture. Okay. So the lancet should never penetrate more than 3 millimeters. Remember that, 3 millimeters. Okay. For a heel puncture, the maximum depth is 2 millimeters. Okay. Remember that bone's there real close. So we don't want to go any deeper than 2 millimeters. Okay. For premature babies, the depth is going to be between 0.65 to 0.85 millimeters. So it's not at all, it's right almost surface-like. The width should never be more than 2.4 millimeters. So here, there's a note on the bottom here where the puncture width is actually more important than the depth in determining blood flow, because the capillary beds may lie close to the skin, especially in those little guys, those little newborns. All right. Here's kind of an example of the heel stick. Notice that they're going on the outer side of the heel. All right, here's this one. The depth of a heel puncture should not be more than what?
B.
B, 2.2 millimeters. Okay. So sites for adults and older children when we're doing capillary collection. The best site are on the palmar surface of the distal segments of the third, which is the middle finger, or the fourth ring finger. The puncture should be perpendicular to the across the ridges of the fingerprint, which lessens the flow of the blood in the grooves. Okay. And I'll show you a picture of that. So we're talking on like this. We're going across, not with, not right straight on it, but across. Okay. That makes sense? Okay. We've been there, done that, but we're just reviewing. So collecting site or capillary collection sites for infants, dermal puncture is performed again in the heel on the medial or the lateral border of the plantar surface. So on the outside or the inside of the heel, not in the middle of it. Okay, right there's the bone right in the middle. For children younger than a year, there's too little tissue available in any of their fingers. For this reason, you're going to do the heel also. Okay. All right, so this one asks you, which finger is the most likely used for capillary collection?
C.
C.
C?
Yeah.
You think C? Okay. Yep,
C.
yep. All right, the location for heel stick is?
B.
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 Oh my goodness, could you imagine doing that in the arch of your foot? Ow. That would not be good. All right, so the steps for capillary collection. You're going to have your requisition form. You're going to sanitize your hands and put your gloves on, assemble your equipment. You're going to collect and clean that site, position and hold the area. You'll make your puncture. You'll dispose of your blade properly into your sharps container. And you're going to prepare to collect that sample. You'll collect that sample and then complete this procedure. Okay. Then we're going to document on the requisition that you are performing a capillary collection. You'll sanitize your hands and put on your gloves, assemble your equipment, select and clean the site, warm the area first if necessary. If it feels cold, it should be warm for at least 3 minutes at a temperature no greater than that 42 degrees Celsius. You're going to be using the same isopropyl alcohol to clean the site. Okay, you're going to determine how to do this procedure by looking at the patient's age and the test that's ordered, which type of collection tube you will need, what kind of skin puncture device you're going to use, and if you need any kind of warming devices. Okay, again, if it feels cold, you're going to warm it for at least that 3 to 5 minutes at 42 degrees Celsius. And remember, you want that alcohol to be dry before you do the puncture. And the reason we do that, because it does hurt. If it's still wet, it's going to sting more. We don't want any of that wet alcohol going into the draw. So we want to make sure that it's dry first. Okay, so this person is missing a picture. We're warming that site. Okay, so we're trying to get it warm. If we don't have a warmer, we're warming the site. Remember how you guys milk that finger too? This is what that picture means. Then we're cleaning the site. All right. Hold the finger or that heel. You're going to grasp the patient. If we're doing the finger, you're going to grasp the patient's finger with the palm surface up. Okay, holding it between your thumb and your index finger. To hold the patient's heel, place your thumb in the arch, wrap your hand around the foot and place your index finger behind the heel. We're going to puncture the skin slightly lateral to the center of the finger. That is slightly towards the pinky finger, is what I mean, okay? So that the hand can be tilted for easy blood flow into that little container. If you're unable to obtain sufficient blood with the first puncture, is that you can do one more puncture. So most places say in all your venipunctures that you're going to get two times, right? And then if you can't get it after the second time, then you need to find somebody else to help you do it. They don't want you puncturing a person 3 or 4 times. Okay, most policies say that.
I want a TV.
You're going to make the puncture and you're going to dispose of that blade into the sharps container. And then you're going to align the device so that the cut is made across the fingerprint ridges or the heel lines. Okay. Again, you're going to dispose of the blade. So we're just showing you here the finger stick. See how they're holding it and supporting that finger. Okay. Then we're going to collect that sample. So we're going to wipe away that first drop with a gauze, okay? And then we are going to keep the finger downward position so the blood's still flowing. And then you're going to, you can alternate applying and releasing firm pressure if it's kind of slowing down, but you don't want to constantly massage that area. So we're going to collect that sample into whatever the container is that we're using. Okay, so what do we need to be careful of when you're collecting a capillary collection? So make sure that the collection tube is slightly slanted downward, not upward. So it's going to be hard for you to get blood into a container if you're holding it in an upward position, right? So you want to make sure it's downward. You're going to tap the container lightly to move the blood towards the bottom of the container. And you're not going to want to overfill that collection tube. And usually that is not a problem when you're doing these little capillaries. Okay, so here's what I'm talking about when I'm saying the tube is lower. So make sure that the tube is in a downward position and you're filling up that little tube, vacutainer. Okay. All right, order of the draw for the capillary collection. Platelet counts are first, CBCs or something called complete blood counts are next, and then your hematology tests are collected first. Then we move to the chemistry tests. Now, once we get into it today and the next, and well, probably a lot today, but maybe some on Thursday too, we're going to start talking about handling. You know, some of them I talked about that might need to be covered. Some of them might need to be in an ice slurry. We'll kind of break that down a little bit, okay? But platelet counts first, CBCs, hematologies, and then we start with our chemistries. All right, so which sample is collected first in a capillary collection? There's all sorts of kind of answers here.
I'm gonna say the platelets.
Are there 2 good answers?
Is it?
Sorry,
A,
I was wondering.
Oh,
which-
E, A and B.
A and B. So platelet counts and the CBCs are collected first. Okay, so that would be the answer for this one.
I was
Got it.
wondering what happened to my audio and why I couldn't hear nobody. Well, my Bluetooth connected to Dan's car, and I'm like, wait a minute, what's going on?
Oh, no.
So sorry I couldn't answer. I was trying to figure
That's
out what
okay.
the issue was.
So A and B.
Okay.
All right. All right. So then we're going to complete the procedure. So we're going to apply pressure just like we do with the venipuncture site, using that clean gauze. Once the bleeding stopped, you can put a bandage on, except if it's a young child, right? If it's an infant or maybe a real young toddler, we don't really want to use a Band-Aid because they could swallow it. They could get it in their mouth and swallow it. You're going to label your sample container and place it in a large holder for transport to the laboratory. And of course, we're always going to thank that patient when we're done. All right, so we're going to move on to something called bleeding time test, okay? So the bleeding time test more or less measures the length of time required for bleeding to stop after an incision is made. So we're going to kind of go through this process of how long it takes for this person to stop bleeding, more or less is what I'm talking about. Okay. So to perform the bleeding time test, which is called BT test, you make an automated incision. Okay, so it's again kind of like your little dermal puncture. Okay, the depth is set at 1 milliliter and the length is 5 millimeters. Okay, so the depth is 1 and the length is 5. Normal blood time, bleeding time, takes about 2 to 10 minutes. Okay, so there are some inconsistencies in this test, and a lot of places use a PFA, a platelet function assay, or some other kind of test, but they still do perform this, and you may have to do this. Okay. Those tests like the PFA, that is actually a venipuncture test, but let's concentrate just on this bleeding time test. The steps are shown in your book, but I think I broke it down just a little bit. All right, so what we're looking for, again, remember, most often people stop bleeding between like 2 to 10 minutes, okay? What we're looking for is bleeding that does not stop within 15 to 20 minutes means one of two things. Either that patient's condition is interfering with normal platelet plug formation. So platelets help, like when you get a cut, they go running to that cut, and that's what, they clog it up and then they formulate that scab or whatever, they close the area. Okay, that's what we want to happen. Somebody who's still bleeding after 15 to 20 minutes, something's interfering with that. So either something is wrong with the patient or something was performed inaccurately on our end. Okay, so we might have scratched a capillary, we might have went too deep. I'm going to show you what the filter paper is, but your filter paper actually touched the incision or something else happened. Okay. Now, also, there are medications that interfere with bleeding time. Things like salicylates, ibuprofen, and aspirin. Okay. These all interfere with bleeding time. So they make you bleed longer. So if you're going up to have surgery, one of the things they usually tell you is that 2 weeks prior, you shouldn't be taking ibuprofen. You shouldn't be taking aspirin because things even like vitamin E will make you bleed longer, bruise more. Okay. All right. So if only one incision was made, the test may have to be repeated on the other arm. If 2 incisions were made and the 2 bleeding times are within several minutes of each other, it is unnecessary to repeat the test. So we'll talk a little bit about that. All right, so here is the steps for this bleeding time. You're going to assemble all the equipment you need. You're going to prepare the patient and explain to them what you're going to do. You'll position the arm and select a good site and clean that site. Then you're going to put a blood pressure cuff on this person, and you're going to maintain it at 40 mm. So you're going to pump it up to 40 and leave it there. You're not going to let the air, you're going to hold it there, okay? Then you'll position the device that you're going to use. You're going to make, it's actually you making a little incision, and then you start timing as soon as you make that incision, okay? I'll show you a picture of what I'm talking about, but we're going to wick the blood away every 30 seconds. We'll complete the test. We'll attend to that patient. So here's the equipment I'm talking about. So you're going to need your blood pressure cuff. You're going to need some kind of timer, your watch or a timer. Here is the little instruments used to make the incision. The filter paper is in this box here. Of course, you've got your alcohol pad, your gauze, and your tape. There's your blood pressure cuff. You're going to pump that up to 40, like I said, okay? All right, so we've wiped this patient down. We've got their blood pressure cuff on 40. And we've got this little, it's just like your little AccuCheck thing that you use for blood sugar, except it's a little longer and it makes it a little, an incision of 1 to 5, okay? So you, again, you pick that site that you're gonna do it and you puncture that site, okay? There's the paper I'm talking about. So this is called filter paper. So every 30 seconds, wicking means you're just gonna take the blood off of it, okay? You don't wanna touch the incision, but you're gonna wick that blood off of it every 30 seconds. Oh, got a question here in the middle of it. So what do you guys think? Which one of,
D.
what is it?
D.
D.
D?
D.
Yep, all of those. All right, what do we pump that blood pressure cup up for this one?
40.
D.
40.
40. Good. All right. Good. All right, so let's do this. Let's turn to page, what page is it on there? Let me find it. We're going to open our books to chapter 10. We're going to go to the questions at the end. Do those first. Let's get those out of the way. I've got 174. All right, let's see, how many questions are there? 13. How about everybody take 4 and one person will take an extra one for me?
I'll go first.
Okay,
Capillary collections are performed on capillaries, veins, arteries, or arterioles, and I put A, capillaries.
yes.
Number 2, which of the following has a higher value in capillary sample as opposed to a venous serum sample? And I put D, hemoglobin.
Yes.
3, good candidates for dermal collection include patients who require frequent collection, are obese, or severely hydrated, D, all of the above, or E, A and B only, and I put D, all of the above. And then capillary collection may be appropriate in geriatric patients because tourniquets are hard to place in this patient group. Their veins tend to be small and fragile. Most geriatric patients will require only one blood test, or D, they are likely to be obese, and I put B, their veins tend to be small and fragile.
Yep, that's it.
I'll go.
Okay,
An infant heel warming device should be applied for approximately 1 to 2 minutes, 8 to 10 minutes, 30 seconds, or 3 to 5 minutes. And I picked D, 3 to 5 minutes.
yep.
6, the depth of a heel puncture should not be more than, I put B, 2.0 millimeters. 7, which finger is most widely used for capillary collection? I put C, the ring finger.
Yep.
In performing a dermal puncture, the puncture should be, I put B, perpendicular to the whorls of the fingerprint. Oh, that's it.
Yep.
Wait, what was number 8?
B.
That's what I thought. B. Number 9, the location for heel sticks is the center of the planar surface, medial or lateral borders of the planar surface, posterior surface, or arch, and I put B, medial or lateral.
Yep.
Which samples is/are collected first in the capillary collection? Platelet counts, complete blood counts, chemistry tests, all of the above, or A and B only, and it's A and B only.
Yes.
Which medication does not interfere with the blood time test? Salicylate, ibuprofen, aspirin, all these interfere with the tests, and it's all of them.
Mm-hmm.
At what level does the blood pressure cuff remain during a blood time test? 20, 10, 50, or 40, and it's 40.
All right.
How frequently is the blood wicked during a blood time test? Every 5 seconds, every 10 seconds, every 30 seconds, or every 45 seconds. I don't remember. Is it C?
Every 30.
Yeah.
Yep. All right. All right. So I'm going to go to your NHA site. I am on module 3 and I'm under capillary blood collection. Can you see my screen?
Sometimes CPTs may need to collect a
Yeah.
capillary blood sample instead of a venipuncture.
I also did on that too with the follow you.
Chelsea, the CPT, will need to collect from Mr. Claremont, who is about to receive treatment for cancer. This procedure will help preserve his veins.
Okay, Mr. Claremont, I'm just going to collect a little blood from your finger for the blood count Dr. Emerson wants you to have today.
Okay. Using this diagram of capillary blood collection, which of the following is the correct way to collect Mr. Claremont's blood? On the center of the pad of the finger or towards the side of the finger?
What do you guys think?
Towards the side.
Side of the finger.
Well, come on.
Your priorities and goals during blood collection are to keep the
Hold on a
patient
minute.
safe, provide comfort, and obtain necessary specimens efficiently and successfully.
That's not what I want. Okay.
When unsure whether to perform a capillary specimen collection, seek advice from a colleague or supervisor. If the laboratory requisition states capillary specimen for infants younger than 12 months, use a heel stick to obtain capillary blood. The veins of infants are too small for a standard venipuncture, and infants do not have sufficient tissue on their fingers for a finger stick. To choose a suitable vein, it is important to know the acceptable locations on the body from which to collect blood. The preferred location for venipuncture is the antecubital fossa. It is visible when the patient extends the arm with the palm of the hand facing upward. The antecubital fossa is a good site for venipuncture because several large veins here are close to the surface and are relatively easy to see and palpate. Other veins you could use when the antecubital veins are not optimal for venipuncture are the following. Hand veins. Veins on the dorsal side of the hand are the next choice after the antecubital fossa. However, these veins are more fragile than the veins in the antecubital fossa, often roll, and are small in circumference. Venipuncture of the veins on the dorsal side of the hand tends to be more painful than that of veins in the antecubital fossa. These veins are relatively short and thin, so it is difficult to achieve a good angle for a venipuncture. It is relatively easy to push the needle completely through the vein in this area. When collecting blood from a hand vein, it is best to use a butterfly needle because it is easier to guide and the wings give you more control. Never collect blood from the wrist with the palm of the hand facing upward because tendons and nerves are close to the surface in this area. Ankle and foot veins. These veins should be the last choice for a venipuncture. They are difficult to access, easy to injure, and often painful. If there are no other choices, use a butterfly needle for collection. Never collect blood from the ankle or foot vein of a patient who has diabetes mellitus or peripheral vascular disease due to poor circulation in the lower extremities.
Okay. Now we're going to go to module 4. If you're following me. And under module 4, under your module 4, go under the preparing for venipuncture. And then we're going to go all the way down until we get to the infant heel stick.
When performing a blood collection from an infant, the first choice is the heel. Infants up until 12 months of age have blood collection obtained from the heel. Do not perform a heel blood collection on an area that has a hematoma, has recently been accessed for another collection, or has any cuts or scratches. When performing a dermal puncture on a child or adult, the middle and ring fingers on the non-dominant hand are the best choices. The non-dominant hand is preferred because the patient uses it less than their dominant hand. Observe the finger for any factors that can affect the blood collection: scarring, cuts, extreme calluses. Avoid these areas because they will make the blood collection difficult and can increase pain to the patient. Choose a site on the finger that is the least calloused and away from the bone and nail bed.
Okay, so this first question, when performing a venipuncture, which is the following scenario demonstrates the best vein to choose? What do you guys think?
See,
See,
Yeah,
All right, let's pick that.
that was right.
Yep. All right, let's see. I don't want tourniquet. We've done that. Dermal puncture, capillary puncture. Let me find it. Okay, so now we're going under capillary puncture.
Dermal punctures, also called capillary blood collections or finger sticks, are done for a variety of reasons. They can be performed for tests that require a small amount of blood when a patient does not have an accessible vein, but a blood collection is essential, or if the test requires capillary blood. A dermal puncture can also be ordered for a patient who is at risk of iatrogenic anemia, since a smaller volume of blood is used for tests performed using this method. Capillary blood collections are common for many point-of-care POC blood tests, including glucose, cholesterol, and hematocrit. The patient's age, health status, and requested test all assist in determining whether a venipuncture or capillary blood collection is necessary. For infants younger than 1 year old, a capillary collection is the preferred method because it requires less blood. Infants' veins are small, and numerous venipuncture procedures can result in damage to the vessels. Capillary collections require less blood and therefore reduce the chance of iatrogenic anemia. Some elderly adults have compromised veins that are difficult to find. In these cases, use a capillary collection to obtain the blood for testing. Patients who are underweight also run the risk of iatrogenic anemia. Because a smaller amount is needed for a micro-collection tube, the use of a capillary collection helps reduce this risk. A dermal puncture blood specimen contains 3 types of blood: arterial, capillary, and venous. When a dermal puncture is chosen over a venipuncture, document this on the medical requisition to alert the laboratory that the blood has a different composition than venous blood. Even in healthy adults, you can use a capillary blood collection when there is no need for a large volume of blood, when the test is to be performed repeatedly, such as for home glucose testing, or when the test being performed requires capillary blood. In adults, capillary blood collections are performed on the middle or ring finger of the non-dominant hand. In infants up to 1 year old, capillary blood collections are performed on the heel. When the testing requires only a small amount of blood, the patient's condition indicates that a venipuncture is not appropriate, or the blood test requires a dermal puncture, you may need to perform a finger or heel stick. The following is the step-by-step dermal puncture procedure. 1. Introduce yourself. 2. Identify the patient using at least 2 methods of identification. 3. Position the patient. The patient should be sitting or lying down. It can be helpful to have the patient place their hand below the level of the heart. 4. Wash hands. 5. Don gloves. 6. Assemble the equipment: disposable gloves, isopropyl alcohol swabs, or the antiseptic specified by the workplace, adhesive bandage, gauze, lancet, and micro collection tubes. 7. Check the warmth of the hand chosen. A warmed site makes the blood flow easier. 8. Identify the site. For adults and children older than 1 year, use the middle or ring finger, third or fourth digit, for a dermal puncture. The little finger is too thin and the bone is too close to the surface. The index finger is likely to be too sensitive or have thick calluses. The thumb has a pulse, so it should be avoided as well. It is preferable to use the fleshy, off-center side of the finger for the dermal collection. The tip of the finger is more sensitive, has fewer capillaries, and can have calluses. Never perform a finger stick on a finger that is cold, cyanotic, blue, scarred, swollen, or has a rash. If you are not sure whether the finger is suitable for a finger stick, use another finger. If the finger is thickly calloused, choose another finger. 9. If the patient's fingers are cold and the blood supply is limited, have the patient open and close their hand a few times or rub their hands together vigorously. You can also instruct the patient to place their hand below the level of the heart for 30 seconds, or have the patient wash their hands in warm water to raise the temperature, remove any contaminants, and increase blood flow. 10. Cleanse the site with isopropyl alcohol. Let it air dry. 11. Puncture the site with a lancet. When using an incision lancet, one that will make a little slash in the skin, make the puncture perpendicular to the fingerprint lines. This will help the blood form into a large drop that is easy to collect. Cuts made parallel to the fingerprint lines cause the blood to flow down the finger, making the blood more difficult to collect. Many facilities provide and encourage the use of auto lancets, which regulate the skin puncture depth. This is safer for the patients and simpler for the phlebotomist. 12. Dispose of the lancet into the biohazard sharps container. 13. Wipe away the first drop of blood. This helps remove any alcohol or tissue fluid from the blood collection. 14. Allow the blood to drip into the collection tube. Cap the tube when it is filled. If the blood flow is slow or stops, you can have the patient drop the hand below the level of the heart. You can provide pressure to the first joint of the finger with a press and release technique, allowing the blood to form large drops. Do not scoop the blood to speed collection, because this can affect accuracy of test results. If you are collecting multiple tubes, you should have a container for the filled but uncapped tubes while you are collecting another tube. Do not take longer than 2 minutes to fill each tube. Gently invert the tubes to mix. 15. After capping the tubes, use a gauze pad and apply pressure to the puncture site for several minutes. When the bleeding is stopped, put an adhesive bandage over the puncture site if the patient is an adult or responsible child. Children can remove the bandage and swallow it. Adhesive bandages can irritate or tear the skin of infants. 16. Label every specimen before leaving the patient's bedside. 17. Thank the patient. 18. Observe for any complications. 19. Collect all garbage from the area. Check the floor for anything that might have fallen during the collection. 20. Remove gloves. 21. Wash hands. When performing a dermal puncture for other blood tests, glucose, cholesterol, hematocrit, follow the manufacturer's instructions specific for each test. The steps will remain the same except for how the blood is collected and the method the blood is put in the cassette, cuvette, or strip. Follow the instructions for a dermal collection, including wiping away the first drop of blood, and avoid milking the finger, which can hemolyze the specimen or in other ways alter test results. A heel stick is used to obtain capillary blood from infants younger than 12 months. The veins of infants are too small for a standard venipuncture, and infants do not have sufficient tissue on their fingers for a finger stick. Heel sticks can be used for almost any blood test. The following is the step-by-step procedure for a heel stick. 1. Assemble the equipment. Disposable gloves, a heel warming device, optional, isopropyl alcohol swab, or the antiseptic specified by your workplace, a sterile lancet no deeper than 2 millimeters, micro collection tubes, and a gauze pad. 2. Choose the right lancet. Each lancet will puncture the skin to a specified depth. For example, if the child's weight is equal to or less than 1 kilogram, choose a lancet that punctures the skin to a depth of 0.65 millimeters. Never use a lancet that goes deeper than 2 millimeters. A common size used for infants is a 1 millimeter depth lancet. 3. Position the patient. If possible, a child should be supine. Check with the patient's nurse or provider to see whether there are restrictions about positioning. 4. Apply the heel warmer for 3 to 5 minutes. 5. Wash your hands and don gloves. 6. Select a site. The best sites for a heel stick are the lateral or medial sides of the heel. The skin between the lateral and medial sides should be considered a secondary site. Do not use the back of the heel. There's too little skin and tissue in that area, and a lancet puncture can damage the bone. Do not use a site that was recently used or has a hematoma or scratch. 7. Cleanse the site. 8. Place the lancet on the skin and make the puncture. After the puncture has been made, use your thumb and fingers to gently squeeze the heel. Do not squeeze for a long time or use excessive pressure. Doing so can affect the accuracy of the test results. 9. Wipe away the first drop of blood. 10. Touch the open tip of the collection tube to the puncture site. The blood should drip into the tube. Allow the blood to passively drip into the tube. Do not scoop the blood to speed collection, because this can affect the accuracy of the test results. 11. If the flow of blood stops, wipe away any surface clots with a gauze pad and stop squeezing the heel. These actions will remove surface clots that have stopped the blood flow and allow the capillaries to refill. 12. When the tubes are filled and capped, use a gauze pad and apply pressure to the puncture site to stop further bleeding. 13. Observe for any signs of complications. 14. Label all tubes before leaving the patient. 15. Bandage as appropriate for an infant.
All right, so on this question, when performing a bilirubin blood collection on an 8-month-old, which is the following equipment you should gather?
A.
What do you guys
A.
think? Okay, is that what we want?
Yeah.
Good. All right, just a little teeny bit more on this one. Let's talk about the order of the draw for doing this.
The order of the draw is equally important for dermal puncture collections, but for distinctly different reasons. The order of the draw for a venipuncture is followed to help prevent additive cross-contamination. With dermal punctures, because the blood begins to clot as soon as the flow begins, the order of the draw helps ensure that the sample is collected in an order that has the least negative effect on the blood test. The following is the CLSI order of the draw for capillary collection. Blood gas collections. When a blood gas is performed on an infant, the patient can cry or hold their breath during the procedure. Collecting any blood gases first helps ensure that the blood that is tested is as close as possible to what is in the patient's body. Purple, lavender, pink, or pearl cap tubes contain the additive EDTA. Because clotting of the blood can alter the hematology of the specimen, it is important to collect any EDTA tubes as close to first as possible. Green. Green cap tubes contain the additive heparin. Any other additive specimens. Serum. Red or gold cap tubes contain no additive or clot activator. Because the blood from a dermal puncture starts to clot as soon as the blood flow begins, and the serum is required to clot.
Okay. All right, we'll move on from there. We're going to go back into chapter 11 now. Can you girls see my PowerPoint?
Yeah.
Okay. All right, so let's go with this. So now we're going to talk about you can have a beautiful draw, collect it great, but what can interfere with those tests that you might have to go back and do it? Okay, so let's talk a little bit about that. Okay, let me get you guys out of the way here. So variables can occur before they actually end up in the laboratory to process, okay? So the phlebotomist is the most responsible for these errors that could occur, okay? That's you. So there's maybe something, maybe you didn't put it in that ice slurry and the time it got to the lab, it's no good. Or maybe you shook it up too hard and you didn't just, nicely turn it. So there may be other things here. So let's figure out how we can stop those errors from happening. Specimen collection accounts for more than half of the errors of those pre-analytic variables. So remember, pre-analytic means before it actually gets processed. It could be mostly happening during the patient prep and when you're collecting that specimen. Okay. One of the most important day-to-day and hour to fluctuations and composition of the blood. So we need to know also, there may be times, there may be circumstances that actually alter our test results. And here's a couple of them. So somebody's age. So your guys' blood might be totally different from mine because I'm an old person. If you've drank alcohol, if your patient had alcohol, it could interfere with the blood results, okay? Believe it or not, taking tests like in low altitude versus high altitude places may alter test results. If a person's dehydrated, if they're not sleeping well, if they just exercised, it could alter it. Maybe they had cream in their coffee that morning. It altered their cholesterol test, for instance. If the person's fasting, it's going to be a different result, okay? There's also differences between males and females as far as their blood work. Medications will interfere, or even medical treatments. The person, their position, were they lying down? Were they seated when you took that blood draw, or were they standing? Things like that. Pregnancy, obesity, these are all things that can change the way the results come out. Okay, so locating that patient. So you're going on the floor and you've been given a requisition to draw some blood, and the patient's not in their room. So your responsibility is to make every effort to locate that patient, okay? You want to go to the nurse's station first. Maybe they were taken down to x-ray, okay? I've seen phlebotomists go and find them in x-ray, especially if it's like something like a stat or a time collection where it needs to be done. The phlebotomist will go find that patient if they can. Like I said, if it's a stat collection, we want to get that done. All right. So here's a quick question. If it's a stat order and the patient's not in the room, what do you think you should do?
C.
C, locate that person and draw it. So again, like if they went down to x-ray and they're sitting out in the hallway, you can do it there. Okay, we want to identify that patient, right? So things that can happen is if it's emergency requisition and they don't have their bracelet on yet, if the order was telephoned into the lab, the requisitions might be picked up at the site. So you're in the lab and they're not being printed off, but they're being printed off on the floor. So this may be things that kind of interfere with your process. Anyways, you have to identify that patient. Okay, so remember, if that person is in the hospital and they've taken off their bracelet and it's sitting on the table, you're going to have to go get the nurse, tell her to come in there and put one more on them before you draw that patient. If you're in like an outpatient setting, remember, you might need to have them give you their driver's license, date of birth, and all that good stuff. Okay. All right. So you come into the room and you're supposed to draw blood and the person's sleeping, or maybe it's an unconscious patient. What do you do? So you should make 1 or 2 attempts if it's somebody sleeping to wake them up, and then give them time to be oriented. Now, when if you've ever been in the hospital and then you're in the middle of the night and they wake you up to do your blood draw, how often have they waited till you're like with it and conscious before they start pulling on your arm? Probably not, right? Has anybody encountered that?
Yes.
Yes, it's awful.
Yeah, Lord.
It's like, what, and they're already drawing on your arm. Yeah. There are times when you must draw from patients who are unconscious and cannot be awakened. So that's just part of the job. That's usually kind of places like ICU, emergency departments, or nursing homes. Okay. But you may have to do something like that. All right. You walk in the room to draw blood, and let's say the Catholic priest is in there. What do you do? Okay. Well, if it's a physician or a priest or some kind of clergyman in the room, you're going to try to return at another time, unless it's a stat or a time collection. And at that time, you're going to explain why you're there and that you have a stat blood draw. Okay, now the doctor may be not so nice about it, but you do have to at least verbalize that. And it's okay to ask a clergy to step out for a second because you've got something that needs to be drawn right now. Okay. So if the physician enters the room when you're preparing everything and it's not like immediately stat, then you can leave the room and then come back in when he's done. They usually aren't in there very long. All right, now you walk in and there's visitors in there. What do you do? So you're going to greet them just like you would the patient. You might say, hey, listen, I've got to draw some blood from Mrs. Smith, and could you step out for a second? Okay. Most people will leave just because it would be a distraction. Now, I know my husband probably would not leave, and he would tell them that. So, you have to respect that too, I think. Okay. Unless that patient's like, I don't want my husband in here, that kind of situation. But if your significant other is in there and they're like, I'm going to stay, it's okay. So you walk in and you've got somebody who's very apprehensive. They're scared to death because they've heard horror stories. They've never had their blood taken in their life, and they've heard their mother say, oh my gosh, it's the worst thing in the world, whatever. Okay. So you want to start with talking to them, about the weather, or, just having casual conversation with them and trying to lower their apprehension about it. You walk in the room and somebody's speaking another language. What are you going to do? Okay. Most often there is some kind of system in there, like a translator. Sometimes it's you pick up a phone and there's somebody on the other, you dial a certain number and they can help you translate, that kind of situation. But you do your best to communicate what you're doing. That's if it's a language problem. Now you walk in and the patient says, heck no, you may go. Get out of here, right? He's refusing to do it, and he has the right to refuse that. So then you're going to try to find the nurse and explain that the patient has refused the procedure. And then the nurse might have a better relationship because she's on the floor with them a little bit more. So she maybe come in and try to help. But it is the patient's right. And then if all else fails, then the nurse will probably contact the doctor saying that they refused. Okay. You're going to document this also on your requisition form and in their chart saying that they did refuse. All right. Now, there's problems in the site that you want to collect the blood in. Okay. So the veins are either blocked or hardened. They've maybe because of some kind of inflammation or disease process, or they're getting chemotherapy, or they've been on prolonged IV therapy, or we've stuck them to death. Okay. Whatever it may be, there may not be any good veins left. Okay. These veins usually are susceptible to infection and the blood flow is impaired. And this can also alter the test results if you're going to use a site that has this kind of veins. So we have to try to find another place. Hematomas, they may be caused by that needle going right through the vein. They can also be caused by having the bevel opening only partially in the vein. So you're in the vein, but you're not quite all the way, so the blood's leaking around the site. Or you haven't applied enough pressure after withdrawal, after you take the needle out. Okay, so these are all reasons that you could get a hematoma. Blood from a hematoma is no longer fresh from the vein and can obstruct the vein. It also can help, it slows down the blood flow. So we have to be careful of that. If we have tissue that is swollen, so the arm may be swollen because of lymphedema or some other, maybe it's been traumatized from some way, it may interfere with your site. Again, we've talked about burns, scars, and tattoos. We really need to avoid any of those areas when we're collecting. Like we've talked a little bit about mastectomies. So a lot of times when a person has a mastectomy, they take the lymphs out of the underarm area, and this causes a swollen arm. Fluid does not move well, things get stuck down there. So this may alter your test results, and we don't want to collect in that area. Okay. Now, if a person has an IV, You should not draw blood from an arm if there's an IV in place, okay? You're going to try to use the other arm or at some other site. So the person might have IVs in both. And remember, we talked about that. If there's no other place, then we want the nurse to come in and stop the flow for at least 2 minutes, right? In that arm, if there's no other way to do it. Again, we're not going to draw when there's skin lesions in the area, you know, anything that's healing, that kind of thing, because we don't want to risk infection. We don't want to introduce anything into an open wound. All right, here's one of your questions. Conditions that may alter the quality of a specimen or cause harm to the patient during a blood draw include the following.
All of the above.
All the above. Very good. Okay, so difficulty in finding veins. Alexis. So we're going to check the other arm. Not so good in Alexis either. So how do we enhance that vein? We're going to massage gently upward from the wrist to the elbow. That could be something. You can have the person dangle their arm in a downward position. Has anybody ever taken a long walk and when they get done, their hands are swollen like sausages? Okay, so that traps the blood. It's kind of like having a tourniquet on your arm, right? It traps the blood down in the area that we want to draw. So have them dangle their arm in a downward position to increase the blood in that arm, okay? You can also apply heat. You can rotate the wrist to increase the prominence of the cephalic vein. So these are all different things that you can do. All right, to enhance vein prominence, what can you do? Give me one of these. What do you guys think?
A.
Okay.
Do we want to elevate?
Mm,
If I elevate my arm, when I walk and my hands get swollen, I put my hands up and the blood leaves my arms, right?
Wait, wouldn't it be B?
It's not B. We don't want to tap.
See?
C. So we want to remember, we're going to squeeze the blood and push, massage upward. Okay. That helps bring out the veins too. All right. Now, if all else fails, we can actually put a blood pressure cuff on the area, and it can be placed about 3 to 4 inches above the venipuncture site. Think about when somebody puts a blood pressure cuff and pumps it up way too much. What happens to your veins in your arms? They feel like they're going to explode, right? Well, this will help also. Okay. So about 3 to 4 inches above the site might help. And again, we don't want to make this our first way to do it. Okay. Use an alternative site. Hopefully you'll never have to use a leg or a foot because it can increase the chances of infections, blood clots. If a diabetic, you'd never want to do it in a diabetic or somebody who's on blood thinners. A diabetic sets them up for infection and they don't heal well. Somebody who's on blood thinners, you have a big chance of bleeding, okay? If we're going to do it in somebody's back of the hand, we're going to use that winged infusion set that we were practicing on, which we'll do again. All right, so problems associated with the cleaning of the site. So we're using alcohol, methanol, ethyl alcohol, or the iodine can be used to clean that site for blood. So we're going to use, cannot be used if we're doing a blood alcohol test though, okay? We cannot use alcohol for blood alcohol test because it'll alter the test result. It's going to give a false positive. So we would use this bovidine iodine, except for patients under 2. Hopefully we're not doing a blood alcohol on a patient under 2. All right, for patients allergic to iodine, we're going to use this chlorhexidine gluconate, okay? The iodine is not recommended for dermal punctures because it may elevate test results in things like bilirubin, uric acid, phosphorus, and potassium. And if you do have to use something other than your normal isopropyl alcohol, you will document that on the requisition form. Okay, just in case there's some kind of question about the test results. Okay, what antiseptic must be used when collecting for a blood alcohol test?
C.
Here's a hint, there may be two answers.
F.
What's that?
F.
F.
Yes.
E.
Yeah, yes. So you can use this povidone iodine and this, whatever, this BZLK. All right. Now, problems associated with the tourniquet. You can get hemoconcentration caused by the tourniquet being on there more than that 1 minute. Remember that we said not more than 1 minute. You can get hemoconcentration if you say, hey, will you pump your fist? Because that actually can interfere with that. You can get hemoconcentration if you're going for a vein that's hardened or sclerosed or occluded, or if somebody's been on long-term IV therapy, or if they're dehydrated. Okay. Remember, if you put the tourniquet on too tight, you can get petechiae. You could have a latex allergy. So remember, when you're drawing blood, you want to ask them if they have an allergy to latex. So if we leave that tourniquet on too long, that plasma portion of the blood filters into the tissue, and it causes an increase in the proportion of cells remaining in the vein. Another thing that can happen, prolonged tourniquet application can also alter potassium and lactic acid levels. And remember that petechiae are like those little pin needle, look, they almost look like bruises, but they're just little tiny pin needles all over the area. All right, so this next question, you guys are going to have to think on your own. Can you give me 4 things that can cause that hemoconcentration?
Leaving the tourniquet on too long.
Good.
Pumping your fist.
Pumping the fist. Okay, so if we go through one of those sclerosed veins that are real hardened, also long-term IV therapy and dehydration can also cause all that. All right. So the wing set that we practiced the other day, let's just kind of go through it. You're going to assemble your equipment. You're going to position the person's hand and apply that tourniquet. You're going to insert that needle bevel side up. You're going to go about 10 to 15 degrees, okay? 10 to 15 with the wing set. Collect your sample, finish the collection, and attend to that patient. And of course, you're going to dispose of the wing set. All right. So things that can happen to your patient while you're collecting is they can get dizzy, okay? So syncope is another word for fainting. Before syncope, so have you ever had blood work drawn and the phlebotomist isn't even paying attention to you at all, is just looking at her tubes and collecting, and you might be ready to pass out? Or have you ever seen that? Because I've seen it many, many times. They're off in their own world. They're not paying attention to the patient's face or how they're doing. And then the next thing they know, the patient's going out. So things while you're drawing somebody's blood, you know, the patient's skin starts to feel cold and damp and clammy. They may even start to sweat on their forehead or upper lip. They might start saying, I'm not feeling so well, okay? They may just stop talking altogether and start staring out like in space, or their eyes start to roll back. And then of course their head might tilt forward or back. So we've got to pay attention to that before it even gets to that point, okay? Fainting is more common with outpatients than inpatients because most often the inpatient is lying in bed, right? So they're more apt to feel a little less dizzy. When a patient is dizzy, you're going to provide support to protect that patient. You're going to remove the tourniquet and stop the procedure. Apply a cold compress to the patient's head. If necessary, you're going to have that patient place their head between their knees. Okay. A lot of times the phlebotomist also will start a fan, might lie them back a little bit and put their feet up in the air. All right. Patient's collecting a blood specimen from a patient who states, I'm feeling lightheaded. Which of the following actions should the PCT take?
A.
Mhm. Yep. Okay. What symptoms might a patient exhibit immediately before syncope, before they're fainting? What may you see there?
B.
B. So they start getting cool and clammy. They might have dampness here or on their forehead. All right. Oh boy, hope we don't go there. But seizures. If a patient has a seizure during the procedure, you're going to remove that tourniquet and the needle immediately and apply pressure to the site. If somebody becomes nauseous or starts to vomit when emesis occurs, reassure the patient and make him feel comfortable because they're going to be embarrassed. It's very common for somebody to feel nauseous. If a patient's MPO, you're not going to offer them any fluid or any food. And then if somebody starts to feel nauseous, they say, I'm feeling nauseous, you're going to encourage them to take deep, slow breaths. Okay. All right. A patient is preparing to perform a venipuncture for a patient who's MPO. The patient says, I am feeling nauseous. What do you do?
E.
D, encourage the patient to take deep, slow breaths. Good. Chelsea, you're just busy over there.
Yeah, well, I keep hearing a cat under my house, and I just saw it on my Ring camera leave, so I'm trying to like block it from getting back under there, because literally I was sitting there doing my homework and I can hear meow,
Yep.
meow, like under me, underneath of me.
I saw some more of that. Oh, what is that stuff called? Insulation, right in my garage again. I'm thinking, I hope that cat's not back up there. So I'm at my husband.
Yeah, so there's parts
Yeah.
of my underpinning that have been ripped out at some
Uh-huh.
point. So I'm like trying to like, yeah, but yeah, so I think I
get
fixed it because I can't deal with
Cat over
random
there.
meows. So
I get you.
Yeah.
Okay. So also pain to prevent that startle reflex. So you're about to do your procedure and that patient starts to jump away from you because that's just normal for them to react that way. You're going to kind of talk them through it and say, you know, there's going to be a little pinch. Make sure you have their arms secure so that they don't pull away from you. You might say that it's going to feel like a little pinch, a little poke, or a little sting. Okay. All right. So that person now has a hematoma. And that's when the blood is oozing from the vein into the tissue around it and a hematoma is formed. Again, this occurs when you remove the tourniquet after the needle. So when you want to make sure that you remove that tourniquet and then remove the needle and apply pressure. Okay, lack of blood. So the lack of blood can be caused by defective tubes. Remember to check those expiration dates on the tubes. You've not positioned the needle right. So maybe the bevel is sitting up against the wall of the vein, the bevel's down, or you've actually gone right through the vein, or you actually missed the vein. So there may be different reasons. Again, defective evacuated tube. Sometimes that vacuum just doesn't work. It might be still, it may not be expired, and there's just sometimes bad tubes. All right. Again, if the needle's not properly positioned in the vein, you may have to adjust it just a bit, but we're not going to dig and dig and dig, right? If tube is too large for the vein, causing excessive vacuum to pull onto the bevel and block the blood flow. Also, remember when we're doing the syringe technique, if you go too fast, you could actually collapse that vein. So it's a very nice, slow, steady pull. A collapsed vein is caused by too much vacuum, which I just said, on a small vein, or a too large needle for the vein, or you pulled that plunger too quickly. When you're using the evacuated tube system, a collapsed vein becomes evident when the tube is pushed onto the inner needle, okay? Some people have rolly veins. I do have several of those. I'll show you them. So they're big veins, but when you go and they look great, but when you go to do your puncture, they just roll. So you're going to have to anchor those kind of veins a little bit more. What do you think collapsed veins can be caused for? You give me a couple. There should be about 4 of them.
The needle going all the way through the vein.
Mm-hmm.
The plunger being pulled too quickly.
Yep.
Too much vacuum.
Too much vacuum and maybe too large of a needle. Those are all good answers. Okay. Oops, I didn't hit the vein, but I did hit an artery. Oop. So puncture of the artery is going to produce a real bright red blood, and it might cause spurting because remember, arteries have pulses. So you know you're in an artery instead of a vein. Failure to collect on the first try. The policy at most places say you can do one more try. Okay, get a new needle and a new tube. You don't want to take that needle out and puncture another site with that same needle. You want to start all over again. Okay. For the second try, go below the previous site or use another arm. If unsuccessful the second time, then we're going to find another phlebotomist to help.
When my papa was in the hospital a few weeks ago, the hospital near my house called Minnie Hamilton, the phlebotomist literally stuck him 9 times.
Is she?
Before
I wonder if she's the only one. Now, I think that you could probably be in a situation where you need.
there was another one. She finally got one after the 9th time.
Yeah, that's
and
crazy.
she asked another phlebotomist to help him up in bed, and she said, "I don't know how."
Oh wow, that's terrible.
I was like, okay.
Yeah. Okay. How many vein punctures can you attempt usually?
2.
2.
2.
Yeah, 2.
All right. 2 sounds good to me too. All right. So other things that might interfere with you completing the procedure, the patient requests, sometimes a patient may ask you for water or a change in bed position first. Somebody has prolonged bleeding. Normally the site should stop bleeding within 5 minutes. That person might be on tons of aspirin or some kind of blood thinner. If you can't get that bleeding to stop, then we're going to call the nurse. Hemolysis. Remember, that's the destruction of blood cells and it's releasing of hemoglobin and cellular contents into your plasma. So the serum or plasma is pinkish or red and is hemolyzed, sampled due to like a rupture of a red blood cell. So things that can happen is you've shaken up the tube or not properly collected that blood. Okay, causes. Blood frothing caused by needle improperly attached to the syringe, so it's not all the way on and maybe some air is getting in there. Again, drawing blood too quickly into that syringe, shaking it instead of doing your rotation, failing to allow the blood to run down the sides of the tube when using a syringe to fill the tube, forcing blood from a syringe into a vacuum tube, and using too small of a needle with respect to the vein size. So these all can cause that. There's more. Using a needle smaller than 23 gauge, usually any smaller needles cause hemolysis. Using a small needle with a large vacuum tube. Using a small needle to transfer blood from syringe to tube. Or mishandling and improper transport. So again, you didn't put it in the ice slurry or you didn't cover it up and the light got to the bilirubin or something. Readjustment of the needle in the vein. So you're in there digging around. That kind of stuff can cause that. Okay. Chemistry and hematology tests that are affected by this hemolysis is seriously affected are that word that's on top there, that aspartate. Potassium or lactate, okay? Things that are moderately affected, again, is another, whatever that word is, CBCs are affected, serum iron, and thyroxine. These can all be affected by hemolysis. Things that might be slightly affected is acid phosphate, albumin, calcium, magnesium, phosphorus, and total protein. Blood drawn from a hematoma. The blood in a hematoma is older than fresh blood. And use of that sample can alter all test results. So if you're drawing actually from a hematoma, that's not good. Patient position. So remember this, okay? The patient position, the standard position for drawing blood from an outpatient is them being seated, right, in that special chair. Reflux of anticoagulants. So reflux is the flow of the blood from the collection tube back into the needle and then back into the patient's arm. So we want to make sure we avoid that. Okay. So you might want to make a note about this, or, you know, go at least on there and look at the PowerPoint. These are tests that are affected by the patient's position, because I do know that there may be some of these questions on your quiz Thursday. Albumin, bilirubin, calcium, cell counts, cholesterol, enzymes, hemoglobin or hematocrit, high density lipoprotein or HDLs, iron, lipids, proteins, and triglycerides. They're all affected by the patient's position. And we've talked about this latrogenic anemia. That is anemia caused by us removing way too much blood at the request of a physician. So, you know, this person's getting like 3 to 4 venipunctures a day or whatever, and he's in the hospital, something like that. Compartment syndrome for patients receiving excessive doses of something called anticoagulants, or the warfarin or Coumadin or something like that. They might have hemophilia or something like that. It may cause bleeding into the tissue surrounding that puncture site. Larger amounts may cause compartment syndrome, a condition in which the pressure within the tissue prevents the blood from flowing freely in the blood vessels. So it's almost like they've got a tourniquet within their own bodies.
Yeah, Graylin's dad actually had an incident where he like got compartment syndrome and he had to get like surgery and got like muscles taken out of his arm and everything.
Yeah, it's
It
not
was-
good. Not good. All
Yeah,
right.
so he can barely use his
arm?
left arm. Yeah.
Oh,
Mhm.
that's terrible. All right,
Yeah.
nerve damage. So nerves in the antecubital area can be damaged if they are contacted with the needle during collection. You can get infection, can be prevented by adhering to our venipuncture protocol, and we want to make sure that we're using the alcohol or whatever the cleaning substance is that we need to use for that venipuncture. All right, so specimen rejection. So you've gotten the specimen, you take it to the lab and it gets rejected. Why? And they're saying you're going to have to go back up and do it again. Well, because the clotted blood in an anticoagulated specimen, it clotted, collection in the wrong tube. You used the pink instead of the blue. Contaminated specimens and containers, defective tubes, that beautiful word hemolysis, improper special handling. You didn't put it in the ice slurry and then you walked around the hospital for another hour and then finally got to the lab, so it's no good. You didn't fill up the tube enough. That happens a lot. There's no requisition form. When I had surgery and I had to have the COVID test in the middle of the night and they dug my brain out, the next morning they woke me up and said, we need to hurry. You're going into surgery and you haven't had your COVID test. I said, yes, I did. And I remembered because they took half my brain matter out. Well, the nurse did not put the requisition form into the little package when she sent down my COVID test. So it's sitting in the lab and they have no idea whose it is. So they had to redo it. So that was not a good thing. I was not happy with that nurse. Let's see what else. No requisition form. You didn't label it or you mislabeled it. Okay. You put somebody else's name on there or something. And using
Oh God.
Huh?
I said, oh God, that's like awful to
Yeah.
accidentally put someone else's name on it.
Yeah. I mean, that happens. Expired tubes, you used it in an expired tube. So we definitely need to look at that. The word QNS means quantity not sufficient. So you did not collect enough. Incorrect time of collection. You needed to get it by between the hours of 8 and 9 and you couldn't get there. So you did it 11, but on the requisition form, you put 8 and 9. So that could be also something. Delay in testing, improper special handling. Again, no ice slurry. Incomplete drying of the antiseptic. So you did alcohol and you're in a hurry and you just went ahead and Did your stick and the alcohol kind of interfered with the lab results? Again, unlabeled or mislabeled tubes or use of the wrong antiseptic. So you used an alcohol pad when you were drawing for a blood alcohol, something like that. All right, let's quickly go to the, yeah. Let's go to our book first and let's do those questions. We may do a little bit of this on Thursday because I had a couple of things I needed you guys to do with me. So we may, that was a lot of stuff. We may do it on Thursday. Okay. Okay. Oh, we're going to do the book. So let's go to page, what is that?
193.
192. All right. Anybody want to start? Go.
I will.
Okay. All right.
You want us to all do like
Let's see. How many are there?
14?
14, and there's 3 of you. Somebody take 5 and 5 and 4.
Okay, I'll do 5.
Okay.
Number 1, if a stat test is ordered and the patient is not in his or her room, you should C, locate the patient. Number 2, which laboratory department may require special patient ID? And I put D, blood bank.
Okay. That's right.
Number 3, collapsed veins can be caused by A, too large of a needle for the vein. Oh wait, no,
All
I'm
of the
sorry.
above.
That was my first one. I meant to put all of the above.
Okay. Okay. There you go.
I missed my little eraser mark there. For when an artery is inadvertently stuck during collection, which of the following statements is not true? And then I put A, the sample should be labeled as usual.
Yep.
And 5, which of the following can be a cause of hemolysis? And then I put A, vigorously mixing the tubes.
Correct. All right. Somebody else want to give 6?
I'll do it.
Okay.
Reasons for specimen recollection include all of the following except I put C, prolonged bleeding after needle withdrawal.
Yep.
To avoid reflux of an anticoagulant, you should do all of the following except A, keep the patient's arm elevated above the heart.
Yep.
Conditions that may alter the quality of a specimen or cause harm to the patient during a blood draw include the following. I put D, all of the above.
Mm-hmm.
Povidone iodine is not recommended for C, blood gas straws.
Mm-hmm.
And then hemolysis is B, alteration in the ratio of elements in the blood.
Mm-hmm. Okay. Alexis, 11?
What was the last one?
10, so you got 11.
Okay. Which test is not affected by patient position? And that is B, blood alcohol.
No, it's enzymes. D.
Okay. Lymphostatus is C.
Mm-hmm. No, I have B. Does anybody else have B? B. Yeah. Alteration in the ratio of elements in the blood.
To enhance vein prominence, you can C.
Mm-hmm. Yep.
Hemoconcentration is B.
Yes. All right, let me check something real quick. All right, girls, let's just kind of talk about the quiz that's going to be on Thursday. All right. You know, so number 12 is not B. I'm sorry, I didn't think so when I said that.
I was gonna say something, but I was
Yeah, you
like,
should. Yeah, my key is wrong. I questioned it anyways. So it's a lack of movement of lymph fluid. So C. If you said C, Alexis, you were right. I think you did say C. All right, girls. So quiz quickly because I know you got to go. You need to know what the preferred blood collection in newborns and infants is. What kind of procedure are we using?
Heel stick.
Number 11 in the back of the book also says it's B.
Yeah,
and
that's what I
not-
said. It's, I know, that's what I thought, and that's wrong. My key was wrong also. All right,
so 11 is blood alcohol then?
11. Oh, wait a minute. What? Maybe I'm telling
Yeah,
you.
I think Alexis was talking about 11 there.
Oh, I thought she was talking about, okay, so 11 says what?
Which test result?
is not affected by patient position.
I have enzymes, but
I do
the
too.
book says what? The
Well,
back,
I thought it was blood alcohol, so I looked in the back of the book and it says 11 is B.
all right, let's look that up. Because we do need
I
to,
got B as well because I was
I
just
did.
like,
you got blood
I was-
alcohol also?
yeah. I didn't know the answers are in the back of the book, guys. Wow.
Yeah, but they're not always right. Blood alcohol, which test not affected by the patient's position?
Yeah, because no matter what position you're in, your blood alcohol is still gonna be the same, girl. You still gonna be drunk.
Listen to her. That's funny. All right, let's see.
I don't know though. I'm just like, that's
That's
what
a
I
good
got.
point.
Test affected by position, blood alcohol is the answer. All right, let's fix
Okay.
it out. See, yep. All right, let's take that out. See, you gotta make sure because these keys are not always right. I gotta make a note too here. Okay. Okay, so dermal puncture is gonna be our choice in infants, right?
Yeah.
We're not gonna, okay. Make a note here real quick so I don't forget. All right. We need to know, don't forget to, if you didn't do real well in your order of the draw, that's going to be on there again. Okay. You're going to know what carries hemoglobin.
Red blood cells.
Red blood cells. How long do you warm a patient or a infant's heel?
3 to 5 minutes.
3 to 5 minutes. You make sure you know which finger that is preferred to use for your puncture. Make sure you know what the location of the heel sticks are. Make sure you know the medications that interfere with the bleeding time test. All right. Make sure you know how to treat somebody who's feeling nauseous when you're drawing their blood. Make sure you know how deep you puncture a heel. Okay. You make sure you know how often you are wicking that blood for a bleeding time. Make sure you know which department of the laboratory requires special patient identification. And what else? I think that's it. Okay. We will do some of the stuff that we didn't get to today. We'll do it on Thursday. I know you got to go. Any other questions, girls?
No, ma'am.
All right. See ya.
Bye.
See ya.